welcome back. Did everybody enjoy lunch? Excellent. For those who cannot see the room, we got hands raised. Everybody was excited for the lunch. Hope you all enjoyed your lunch as well. We are excited to get ready for this next session. We have a wonderful panel discussion. As you can see here, our wonderful panel from everything you all heard this morning. You'll be able to ask your questions. We have a list of questions here that will run by all of the panelists. I want to first start by just highlighting something. So in the agenda, you'll see that Emily Schlag is not on there. It's actually Heather is on there. So let's actually, just so you know, Emily is actually taking Heather's place. So let's go ahead and get started. Really excited to have everybody here today. So panelists, thank you for this morning and getting the stage ready for us. We are excited to have Emily join us. Emily, if you don't mind sharing a little bit about yourself so the audience can get to hear a little bit about you.
Sure. Okay, I think I can hear myself. My name is Emily Schlag. I think I've met a lot of you before. I used to be the assistant program director at the Goldring Center in New Orleans. Currently, I'm in New York City. I work for the Stanley Isaacs Neighborhood Center, running a program called Soups Up. And we do home delivered meal kits for families in need of food assistance. We provide healthy prepared meals in addition to fresh produce, recipes, spice blends, dry goods, anything they need to be able to cook healthy meals for themselves at home. We also do workforce training programs where we train out of school, out of work youth in culinary, healthcare, and the tech field in order to kind of set them up for living, thriving wages as they move into their career.
Thank you for that, Emily. So you all have met the rest of our panelists. I want to just get everything warmed up. We'll start with a question for each and every one of you. So as you all know, culinary medicine clinicians have found very unique ways to incorporate innovative teaching strategies with their patients and their families. From community programs to group visits, entrepreneurship to teaching kitchens. Can each of you share why you think it is necessary that culinary medicine clinicians begin to consider the role of food or nutrition security in the work that they do?
I can go first. I mean, this is very important because when we're teaching people about how to cook, what to make at home, we're showing these great recipes that are full of nutrition. We have to consider, are these ingredients available to the people that we're teaching? Can they access these ingredients in their neighborhood? Can they afford them? So it's really important to keep that in mind when we're talking about culinary nutrition, the accessibility, the affordability, the palatability. Is this something that they actually want to eat? Is this something that their family will accept and eat as well? So all of that needs to be taken into consideration when we're teaching culinary medicine. So we have to constantly adapt to our audience to make sure that they can actually take what we're learning and apply it at home.
I also like to add that when we're talking to patients and clients or community people, that it's important to recognize their cultural differences in the way that they prepare their food. And so it's no one size fits all. So I think we need to take in consideration people's culinary skills, but also their cultural skills as well.
I agree with everything that you said. And I think that with the growing movement to focus on precision medicine and trying to tailor individual treatments to that person's needs, from their genes to their outcomes, on the flip side of that is recognizing that food is such an important part of health and health management, health maintenance. But food is shaped by so many factors beyond just individual preference and choice. And so thinking about if we go through someone's family, their community, their city, their food system, all these things are impacting the foods that they can eat that then go on to impact their health trajectory. So I think recognizing the role of food and nutrition security is extremely important if we're concerned about preserving individual well-being.
Thank you for that. Next question for Karen, this is specifically for you. We see empty lots in cities. How do you start advocating and supporting community gardens? How is it sustained?
Yes, so I think someone asked me that question during lunch. And so, for instance, if you happen to see an empty lot, 3 things you should do. Number one, find out who owns it. If it's privately owned, you can ask the owner. If it's city owned, you can ask the city. And if it's an organization or even a religious congregation that owns the lot, ask them. In New York City, it's easy, believe it or not, even though there's hardly any left because of development. If you come upon an empty lot, all you need to find out is number one, if it's still considered to be not under development, you need 10 people that are willing to garden, and then you sign a 4-year lease agreement. That's easy. The really question is, and you should advocate for, is the fact that ask if the lot is being owned by, like I said, an individual, a private organization, a church, and pursue growing your food. It's easy.
Thank you for that. Cindy, this is a question for you directly. So, were there any discussions with the families regarding what they would want or need to reduce their stressors? Any suggestions on how this can be addressed in communities experiencing high rates of food insecurity?
Yeah, that's a great question. How do we address the stress that comes from food insecurity? And to be honest, when I talk with families, most of the adults were just in shock that someone wanted to hear their story and to understand their struggle. Like, this is not something that they have shared with, to the extent that we were talking with them in a 30 to 45-minute interview, where they even considered, how much am I going to open up to this person I just met about my very personal struggles with food and feeding my family, compounded with their health needs or their food preferences of their children, or all the things that they have to factor in when they're shopping for food. So then asking them, how do you think our programs and policies should better address this? Because we did ask that question. A lot of our families had just never thought about it before because they never expected to be part of the solution. And I think that's something that really needs to change when we're thinking about how do we improve our federal food programs, how do we improve our community food programs. We need to talk with the people who use them to understand what are the challenges, and then what are some innovative strategies that our participants could suggest, because they know this program intimately better than any of us, on how we can improve their entire experience and hopefully also alleviate some of their stress.
Panelists, feel free to add on to any of the other areas too, if you need to. This is for Karen and Emily in particular. So this is a question that came up. What role can families with lived experiences of food insecurity play in culinary medicine? As you all may know, those who are doing culinary medicine are a variety of different fields, have a variety of different backgrounds. What role can families with lived experiences of food insecurity play in culinary medicine?
Okay. And this kind of piggybacks off of what Cindy said. It's important to listen to those families, to have community advocates, to ask people, what do you want? How can I help you? I think oftentimes, because we are the experts in our fields, we are professionals, we, have a lot of knowledge. So we think, okay, my plan is going to work and my plan might be the best plan, but we have to be willing to listen to people and what they want and adapt our programming to fit their needs.
I think what we really miss out is storytelling. I think that's a lost art that's being lost, especially when it comes to new people getting involved in the food movement and learning how to cook. Believe it or not, there's a lot of young people, they don't know how to cook. And there's so many recipes that are out there that are being lost. And so what we're trying to do is getting people, especially young people. I tell young people, take out those some Samsung Galaxies and iPhones and ask grandma and grandpa, abuelo, about the stories of farming and cooking, and carry that. And I think it's a lost art of storytelling is so important in the work that we're doing.
Karen, I'm going to come right back to you. One of our guests said, can we discuss the difference between food insecurity and food apartheid?
Yeah, so we're starting to go away from food security because that word security is somewhat a trigger, especially in communities of color when you use the word security. And so I coined the term food apartheid, like I said, because of the fact that we weren't having a conversation about the real problems when it comes to food. And by saying, using terms like food security or food insecurity and food deserts, it doesn't capture the essence of what is happening. And we need to start talking about food along racial lines, because a lot of food is based on the skin color, the color of your skin. A lot of food is based on where you live. If you live in a low income neighborhood, food is totally different than a high end neighborhood. And then it's also on economics. It seems like, there's sort of branding when you are poor, you don't have money, that there's this scarcity connotation that's noted with it. But the fact is that we need to have those hard conversations, because in essence, if we're trying to fight food insecurity and work on food apartheid, then we have to make sure that everyone has a right, like I said, to food that is fresh, that is local, right to clean water, right to seeds, right to land. This is who we are as Americans. This is who we are as human beings. And so, again, let's start having those hard conversations, those difficult conversations, to get out of our comfort zone, to make ourselves feel uncomfortable to be comfortable.
Beautiful. Do we recognize food as a human right or just a thing, right? That's a really strong statement. I'm going to ask this question to everyone from this list that I have here. This says there are many different approaches to teaching, promoting healthy eating practices in homes across the country. Can you all describe strategies to ensure what our educators are teaching is culturally appropriate?
So I teach college students, different demographic than maybe who others teach in the audience, but I give a lecture to my graduate students on which diet pattern is best for health. And I talk about how the low-fat diet craze didn't help improve our health outcomes from the 80s and 90s. I talk about research from low-carb, keto-based diets and what those are showing for health outcomes. And I conclude by saying one of the diet patterns that has been most consistently associated with both improved physical and mental health is the Mediterranean diet. And then I show a slide that compares a Mediterranean diet, which many of us have heard of. It's very much embedded in fruits and vegetables, whole grains, unprocessed foods, olive oil, nuts and seeds and things like that. And I compare that to other traditional diets from Asian cultures, African cultures, South American cultures, Latin American cultures, and I show that those components are exactly the same. All of our traditionally based diets are rooted in whole foods, fruits and vegetables, whole grains, high fiber, low processed foods, low sugar, low salt. And so depending on who you are talking to, if the Mediterranean diet is something that resonates with that patient, with that person, because they're familiar with that term, then fine, use it. But the Mediterranean diet is not necessarily what my ancestors ate and what my family ate when I was growing up. And so to say that I have to eat in the region of the world like this could be off-putting for someone who isn't familiar with the Mediterranean diet. So I say to you to recommend diets that are traditional for your culture. And that those traditional foods have the same health promoting properties and are the same ones that are associated with improved health, physical and mental health outcomes for populations around the world.
Oh, am I working? Okay, I'm on now. I used to work at a teaching kitchen in the Bronx in New York, and I can't tell you how many times I had someone come into my classes and say, my doctor told me that I can't have rice. I shouldn't eat beans and rice, that the way that my family eats is unhealthy. The doctor didn't know everything that they were eating. They just saw the color of this person's skin and assumed the way that they eat at home and assumed the way that they prepared their foods at home. And then it was on me to assure them that your beans are healthy. You can have your rice and beans. This is okay. The way that we're eating is okay. The vegetables that you're preparing, the greens that you love to eat, this is okay for you to have. And kind of going off of that is we a lot of us are trained with a very Eurocentric approach to what is healthy, what is good. And we have to be comfortable in being uncomfortable and unlearning some of that and relearning that so many cultures have healthy eating patterns to them, listening to our patients and what they're actually eating and what they want to eat and going from there.
The biggest thing that New York City schools did was do away with home economics. And I think they need to bring that back to school. I remember going to school and learning how to cook. A lot of young people don't know how to cook. They don't even know how to boil an egg. And I think it's a disservice. And I'm trying to get parents to make sure that they can implement bringing back home economics, teaching people how to cook.
Beautiful. Beautiful. Let's build upon this question. So what messages may we be putting out there that could be considered harmful to our families? Not necessarily us, but maybe someone else out there. What messages may we be putting out there as culinary medicine clinicians or as nutrition people that may be more harmful than beneficial? What do you all think? Anybody can answer.
I have feelings on this. So like I said, the way that a lot of us have been trained is certain foods are good, certain foods are bad. And there's a lot of this like black and white thinking. And so a lot of messaging is this food is junk, this food is trash, this food is poison, this food is killing our families. And for someone that is food insecure, that has a hard time just feeding their families at all, we see this shame, this guilt that people feel when they're just doing their best to put food on the table and they're being told, you're killing your family, you're poisoning your children with whatever you're able to feed them. Now, would we love for them to be feeding their family, fresh produce, whole grains, beans, nuts, and seeds? Yes, we would love that, but we need to be careful with our messaging that not all food is poison, is trash, is terrible for us all of the time. We want to kind of reduce that shame, reduce that guilt around our messaging on food so that, I don't know, I hate for people to come to me feeling so guilty about what they're eating. I really want to try to reduce that guilt and stress wherever possible. And that comes with how we're talking to our patients, our clients about what they're eating.
Really powerful thing what you're saying, and I think that perspective in which we come from can actually either open the door for more conversation and more engagement with our families, or close the door. Once they start hearing that in very inflammatory language, you lost that partnership, you lost that relationship. So I think that's a really rich conversation. Let me ask this question to Cindy. It's directly for you, Cindy. So it said, were the consequences of food insecurity that were listed on your slide associations or causation, right? How did they tease out food insecurity's impacts versus poverty in general?
That's a hard one. So how do you differ between association and causation? I think a lot of people think in order to infer causation, you have to have an RCT, a randomized controlled trial. Problem is you can't randomize food insecurity. It's unethical, and no IRB would ever allow that. I actually had a colleague who tried to randomize the thought that someone might have to restrict their caloric intake for the next week to try to simulate how thinking that you're going to change your food behaviors for the next week might impact your on-the-spot decision making. But it was not a successful study because you can't replicate the experience of food insecurity in a lab-based setting. So every study that I showed you, every outcome that I showed you came from an observational study. Now you can take that as what it means. It's an observational study. As a nutrition researcher, most of my studies are also observational because it's really hard to do an RCT over a long period of time to look for how some of these outcomes might manifest. As a researcher, I try to tease out the association between food insecurity and poverty by restricting my sample to a lower income sample and then further adjusting for income, for education, and for other proxies of socioeconomic status that are available in the data set. However, I always acknowledge that there is some potential for other unexplained factors to be contributing to the associations that I have presented in the paper. With the number of researchers in this field who are studying food insecurity and children and adult health outcomes, the consistency of these results in different data sets across different time periods in different geographic settings, using these validated measures of food insecurity that we have, shows me that there is something there, that these are not just mere artifacts of the data, that food insecurity is harmful and leads to the host of outcomes that I showed you. I think it would be really, really unlikely for something else to be contributing entirely to what we're seeing. But I will acknowledge that food insecurity is highly correlated with economic or financial insecurity, housing insecurity, transportation insecurity, all of these other social determinants of health, which are really hard to control for in an observational study. But I don't actually think that matters so much because at the end of the day, families who experience food insecurity are more likely to have other basic needs insecurities. So if we address food, then we can start to work on these other things as well.
Beautiful. I'll highlight something on that too. When we use the word poverty or poor, typically we're talking about an income level. Below this income bracket is considered poverty. Food insecurity is not just an issue of poverty. There are a number of people who are way above the poverty line who are experiencing food insecurity as well. So I think that's an important thing to recognize because it's not just that income that sort of does that. One thing we talked about it previously is that food insecurity is not intermittent fasting. You recognize that, right? Intermittent fasting is a voluntary thing, right? You voluntarily take food away. 36, 12, 8, 6, whatever the numbers are that you're choosing to use. This is not voluntary, this is involuntary. And this is something that cannot be faked in that kind of way. The other thing I'll really highlight, because the question was here about what is meant by the SNAP challenge. What is meant by the SNAP challenge? SNAP challenge is typically what we say is before this new burst in SNAP dollars, the amount of SNAP that individuals were getting is about $1.40 per person per day. It's on average. So the request is to somebody to try to live on that for a week period of time, right? Per person, per day, per meal, right? So thinking about that, I think, is an important piece of thinking about. And when my students have done that, it's great. They learn about all these things, but a lot of times they're like, well, some of them are like, it's fine. I just go and grab this other stuff from my pantry or go and get this other stuff. And they're not realizing that you have this security net around you that's allowing you to sustain through this week period of time. But what happens when some of those little boundaries that you have go away? Then what, right? So I think it's an important thing to think about. And that's sort of the SNAP challenge, sort of taking a period of time and living it that way. I want to sort of round out this question that I see on the culture. This idea, and Emily, you kind of highlighted it. Karen, Sydney, and Emily, please feel free to talk about this. This idea of kale often evokes very positive responses from sort of this idea of a Eurocentric health audience, while terms like collard greens are often considered less healthy. How do we ensure that the diversity of foods, cultures are appreciated in our quest to improve health in culinary medicine? You kind of highlighted that, but if there's anything else you want to add to that, please feel free.
Don't listen to what people are saying. I mean, embrace your culture and embrace your foods. And I think that, collard greens, I love collard greens. I like kale. I mean, people have been eating kale and collard greens for years. And again, it comes with how people portray certain foods as being elitist, like it's organic. And we need to get away from framing foods that tend to separate us or put us in silos and celebrate our food and celebrate our differences and celebrate the diversity that comes with food and not get sucked into again what big ag and what marketers say about our food, and take control of our own food and what we eat.
Emily, let me throw this one towards you. It says, Emily, what challenges have you noticed in teaching families that may have been struggling with food insecurity in your community programs? And anybody can also add on this as well. In doing community education, in doing programming with families that may be struggling with food insecurity, what kind of challenges are you all noticing in when you're engaging these families and teaching these skills?
This comes back to something I mentioned earlier, but people's access to food and certain ingredients. I think sometimes we just assume like, oh yeah, everyone has a jar of mustard in their fridge that they can make a vinaigrette with, or yeah, everyone has access to cocoa powder that they can make some, black bean brownies with, or something like that. And so something that I've always had to kind of constantly learn and adjust to is what ingredients are available to the people in this community. What are they buying? What are they using? And kind of constantly modifying recipes to meet people's needs and show them how to use, what they have access to, and constantly listening, and people telling me, when I go to the food pantry, they're always giving me cabbage, or they're always giving me brown rice, and I don't know how to cook brown rice. So listening and actually showing people how to cook the foods that they do have access to, instead of just saying, oh yeah, you can buy all these things at any grocery store. It's always available. You can definitely, just run on over and buy that $4 jar of mustard or whatever other ingredient that we all kind of just assume is normal. That's not always the case. And I don't know, it's hard to give like an overarching statement. But it's just learning and listening to people and what they have access to.
Question that came up. It seems patients go to doctors when they are sick. Where do families learn about nutrition? Education is key, but where can they best learn? Anybody can answer.
Dietitians are pretty cool, I guess. But that's hard though, because does insurance cover seeing a dietitian for, hey, I just want to learn about nutrition. Can I go see the dietitian? No. What about a private practice dietitian? $100 for a consultation. It's hard. That's a question that, theoretically, we have culinary medicine programs all over that are accessible, that are free or low cost, and anyone can go see, a community-based dietitian and learn about nutrition, but that's not always the case. So, expanding access to dietitians, funding programming so people can learn about nutrition is important. And then I forget, Kofi, I think you mentioned this, if you're in the clinic with someone, knowing about what resources are available and knowing how to refer out, knowing what is around you, instead of just saying, oh yeah, I don't know, go find a dietitian. Say, no, I know about these programs. Let me link you up with them. Have that warm handoff so that people, have an easier time finding those programs that they might not know about otherwise.
As being a home care physical therapist, I know that a lot of it came from the doctors writing an order or prescription. So it's up to the doctor to write the order, to add either a dietitian or nutritionist to come to a person's home as part of an evaluation. So that's at the disposal of clinicians to write that prescription, to make sure that, especially when people are seen at home, I did home care. You got the nurse, you got the therapist, but you had, and the social worker, but you never got the nutritionist or dietitian unless you had to ask the doctor to put orders for it, for something to think about for the future.
I had this great point and it slipped my mind, so it's going to come back. All right, here goes another question. Oh, yes, let me highlight this. So I think oftentimes when we think about learning nutrition, we think about didactic learning. Sit in front of a lecturer that teach us, right? Top down, top down. But I just want to highlight some of what the work you're doing, Karen, too, because I think there's a lot to learn about experiential learning, getting out there, doing, getting on the ground. Right? You learn so much by actually doing these things versus always having to be taught sort of this top-down model. So think about those models as well, where we're all sharing together at the table versus always the model where I'm teaching from the top down. I think that's some, and also let your families share with each other, right? That community sharing is so powerful as well, and a great part of learning as well to keep in mind. Question for the for the team here. What advice do you have to reduce stigma when developing and implementing programs that address food insecurity, that address hunger? How do you reduce stigma?
I don't have a great answer, but I can give you an example. Part of my work at the University of Michigan has been to help with the launch of our on-campus food pantry. And the last 10 years or so, there's been a wave of studies showing that college students are experiencing food insecurity at levels far beyond what we previously have thought. We previously thought college students didn't experience food insecurity, but we know that that's not the case. And at Michigan, it was 32% of our students were food insecure at some time during the last year. So our students actually mobilized and created an on-campus food pantry. They were doing monthly food distributions, and they were spreading the word on their own on social media. And there would be lines of students down the center, down the street, waiting to get a bag of food once a month. With some university help and a lot of stakeholders, we now have a permanent space where anyone can go shop at a food pantry 5 days a week. Now, students who experience food insecurity might not feel comfortable going to this place because they don't want to be seen as they're the only one in their friends who has to get food from the food pantry. So one of the things we did was we called it the Maize and Blue Cupboard. We didn't use the word pantry in the title. We have tried to make it a wraparound service so that there's a teaching kitchen so people can go and learn how to cook. There's going to be other services there that the university provides. So you're not going there just to get food. You're going there because your friends are going there. In my courses, I tell my students, even if you don't think you're food insecure, go check it out. Bring a friend. Okay, you never know like what you might find there. You might find something interesting. It is open to everyone who has an ID card who can swipe in. And so they don't ask you any personal information. And I make this point because I want to normalize help-seeking behavior. If someone is experiencing food insecurity, we want them to be able to go to the place to get food that they need. And so we try to do these little things just to make sure that if there is a barrier that someone is feeling to going here, they have someone they can go with. They know other people who went there and talked about the great plums that they picked up the other day. And so, we try to do these things, and our case numbers have gone up a lot since we've opened, which really shows the need on our campus. But these are just little tips that I have seen worked well for us. But I think figuring out how we can continue to normalize help-seeking behavior is key, because we also know that for patients who screen positive for food insecurity during a well visit with their healthcare provider, a good proportion of them don't want help. They say, I might worry that my food runs out, but I don't want assistance from you. Why is that? We don't know, and we need to ask those questions, because if they're reporting a social need, then perhaps there are resources that they could be referred to that could help them.
Just to kind of add on that, something that I've just observed is a lot of people will have access to, a pantry or some kind of program, not realize it or think that's not for me. I don't want to take away from someone else that is more in need than I am. So a lot of people need food and don't realize that, no, like this is for you. This service, this program, this experience is for you. So a lot of that is also just kind of reframing the way we think about those help-seeking behaviors and reassure people that you are not taking away from someone else by utilizing this program, this experience, this service. If anything, you utilizing it is going to help more people to have access, because how do we get funding? By showing that people are using our services. So a lot of it is really just reframing that. And yes, you are deserving. Yes, you are owed this. This is for you. And you are not harming anybody else by utilizing it.
I want to get to the root of things. I want to talk about a little bit about soil. Sorry, that joke. So question for Karen. What do we do to support land ownership and access in and around urban areas where property values are high? There's a few more questions that really dig into the ground, and I want to start by asking you that question.
Yeah, so the big key is around, which is gentrification. That's really hard as people who have lived in communities all their lives are now being pushed out because of development and their privilege and their power and their privilege. And so what people are doing, they're organizing. Affordable housing groups are organizing now to make sure that communities have the resources to stay. And sometimes it's really galvanizing and participating and protesting against a landlord that doesn't provide heat and hot water, or a landlord who's warehousing a lot of empty apartments because he feels that eventually he'll get more people to pay higher rent. And also, I think we're starting to talk about people with power and privilege, the impact it is having when you displace communities of color that have been in their neighborhoods for so long, and starting to have those conversations that when you see that your power and your privilege is moving people out, you need to take a stand on it. So we're starting to have those hard conversations whereby everyone needs and has a right for decent housing, but not at the expense that you're going to push out a whole community. And I've always asked the question to people is, why is it that if you're in a low-income neighborhood in a community of color and you start seeing people move out and you're not questioning that, then there's something wrong with that. And so there's always this sort of difficulty in balancing now green spaces, open spaces with development. And now we have some new urban planners are starting to think about, how can I develop housing with green space? And so you're starting to see people think about, having buildings with gardens and rooftop gardens. And so starting to have those conversations, because we have to look at the future. 2025, an additional 2 billion more people, mostly in urban areas. So how are we going to be able to balance green space, open space with development?
Beautiful. Let's highlight this soil question someone asked. So Nat Geo published an article about a decline in nutrients in our planets. The question is, how are culinary medicine practitioners adapting? But I guess also for anyone here, can you talk a little bit about this soil concern that continues to be brought up? Is there any highlights that you all could bring around that?
Yeah, because people now starting to do a lot of work around regenerative agriculture, agroecology, really understanding the basis of soil and how soil is so important to manufacture the food that we're eating. For so long, I used to think that soil was dirt. How many thought the soil was dirt, right? But soil is alive. And so now you're starting to see farmers starting to look at changing their growing practices, not relying on chemicals to grow food, but using nature. And I think that we're starting to reinvent ourselves in working with nature instead of against nature. And it starts with the soil.
I love that. Soil is alive. That's really good. Question for everyone. How do you respond to patients when they say healthy food is just more expensive compared to junk food? I can't buy it. It's just more expensive.
I guess I'll say something. It can be. It definitely can be more expensive. And I think we can't just kind of, push that concern aside and say, well, too bad, you should have, that more expensive food anyways. Something that I think has been really helpful, at least in my experience in teaching cooking classes, is opening up possibilities to people when they're at the grocery store. Something that Kofi was saying earlier, where you're not going to buy a food if your family's not going to eat it. You're not going to buy a food if you're not going to cook it and have it go to waste. Why would I just throw money away in that way? But if we can, show people how to utilize other foods, maybe foods that are very cheap and inexpensive, but maybe just need a specific, cooking method or recipe to make them delicious. If we can kind of open up those possibilities, we can find healthy foods that are going to be affordable, that can feed our families, that they will enjoy, so that money is not going to go to waste. And something I love about the cooking classes, especially if they're free or low cost, is it's a really safe environment to try something new, to see if you actually enjoy it, to see if that's a recipe you would make at home. And so it's a great way to introduce new people to foods. I like to say it's like a really low stakes way to like introduce people to these new foods that can be affordable and still good for them. And then they can choose, do I want to spend my money on something I'm familiar with that maybe isn't as nutritious, or now I feel confident in taking that same amount of money and spending it on something else that now I know how to cook it so I can get a little more nutrition in some aspect of mine and my family's diets.
Any other suggestions? I guess to build off of that, Karen, it looks like somebody was asking, do you offer internships on your farm for others to learn from you? Any proteges?
Learn from your family. No, we don't do apprenticeship. We do have community days where we invite the community the last Saturday of every month. So June 25th will be the first Saturday from 10 to 1 to come up and bring your family and friends and learn about what we're doing at Rise and Root Farm. On the first couple of hours, you're getting your hands in the soil. It's black dirt. It's the black dirt region of Orange County, 40% organic matter. You've never seen dirt like it, or soil like it. And getting people to put their hands and getting dirty and planting and doing activity. I call it Farming Olympics, so because you're going to be doing a lot of weeding. And then the next couple of hours is just question and answer. But you'd be surprised how many people have never visited a farm, have never been outside of their comfort zone to see where the food comes from. People think food comes from a grocery store, but they don't understand that it comes from a farm, and they never ask who grows the food. And a lot of our food is from farm workers, and we don't talk about labor. And I think something that we need to talk about when it comes to food is the impact labor has in this country, especially immigrant labor, and how they're being treated. And we need to, and that's an invisible economy that goes unnoticed, but we need to bring them to the surface because they are the ones that are the driving machine for this economy, for us to eat the food that we have on our table.
Cindy, I want to start this question with you. So question is really strong question. It says, should we now rename the Mediterranean diet so cross-cultural education and teaching can be less confusing for patients? And then the follow-up is, well, what should we name it if you were to rename it? Cindy's diet.
Well, isn't that a loaded question? I would love to rename the Mediterranean diet, but I don't, other than calling it like a healthy eating diet, I don't know, or a traditional foods diet, or an unprocessed foods diet. Like, I have not thought about what a good name could be, because that term Mediterranean diet has been along since Ansel Keys did his 7-country study, and it's been studied and evaluated in so many different studies around the world showing its health effects. But I do think with our movement towards more inclusivity in nutrition, it might be time to think about who might be excluded if we keep calling this Mediterranean diet when really we're referring to the same things. And so at least like for my own students, when I'm trying to teach them about which diet pattern would they want to adopt for them personally or recommend for their families, given that they're taking a nutrition class, I always tell them, like, go back to the traditional foods of your culture, of your family, because our ancestors didn't go around and eat many of the ultra processed foods that we have saturating our food environment. So if you go back to those traditional foods, that I think is a much easier message to digest, pardon the pun, and to like promote a message that our families could adopt. Because for my own family, if I were to say we have to eat kale and we have to eat quinoa and we can only eat olive oil, like my own family would rebel and say, like, I don't know how to cook kale. I know how to cook gailan and bok choy and like these other very traditional greens, but I don't know how to cook kale. So what do you mean we have to eat this? This doesn't taste good to me. So they've rejected those messages, and I can tell you, like, that does not work. But if I say eat the foods that you ate, like as a kid, that you remember that are rooted in unprocessed foods, then that is a message that can resonate with them.
You want to add to that?
I'm going to call it Cindy's diet.
Cindy's diet. Show of hands for Cindy's diet. We have 12 in the audience. 12 in the audience. Okay, so I think it's interesting because I always think about this. So are anybody familiar with the, it's part of the curriculum, but the Blue Zones? Show of hands. Blue Zones, group of centenarians, right, live to 100 or more around the world. Found there's a few different blue zones around the world that we see, and there's sort of 9 principles that sort of join them all together, right? And it's interesting because I think back to sort of my family's background in West Africa and the foods that we eat, and the rice and the plantains and the different greens and these beans and all these different things. I'm like, well, why didn't we make the cut? Like, what's going on? And honestly, it's like, you know, there's other things, right? The water and the cholera, and the other things, infectious disease, that really hinder that opportunity to get to that 100 and above and beyond. But I think there's so many more blue zones out there that we can respect and recognize. And I just think it's a really interesting thing. So Cindy's diet it is. Cindy's diet. All right. So next question, I'm going to send to, I was going to save this one, but I'm going to go ahead and get into this one. This is a really great question. It says, so you all know about this White House conference coming up on hunger. The question was asking each of you, it said, if you were leading the White House conference on hunger, what would be the top action items and policy changes you would put in place? Whew. Drop that bomb over there. What do you guys want to see?
I feel like that's a very loaded question.
Mhm.
Kathy. Can we raise the minimum wage, give people more money so that they can, you know, afford the necessities that they need? Housing, food, clean water. I don't know. It always comes back to money for me. I'm not a politician.
You could do anything you want.
I don't want to be a politician. We need to raise minimum wage. I'm going to leave it at that.
Love it.
I would like to see more diversity in the food movement, in the decision-making policies that's going on. I think it's being controlled by too many elitists. And so I would like to see everyday people from different backgrounds and different ethnicities making the decision for the mass of people with different faces and different voices at the table, getting things done instead of the stagnation that we're seeing that's happening in Washington now.
I think we can learn a lot from what happened to our federal food programs during COVID, and the ability and the efficiency in which we adapted SNAP, WIC, school meals to make sure that food was getting out to people during this public health emergency I think as a researcher, I never imagined that this was possible because change is so slow, especially for our food programs. But the ability to get pandemic EBT out to all the families with children who were in schools, to have these flexibilities for SNAP so people no longer have to go to an office to apply, to raise the amount of SNAP benefits, and then to now reevaluate a thrifty food plan so that people, their SNAP benefits are more closely aligned to healthful eating. All of these should be permanent changes. Some of them are, but universal free lunch, like all of these are things that we have shown because of the pandemic are feasible. So where can we go from here? Hopefully not backwards, because I know some of these are tied to the public health emergency, which is expiring. But it just shows that the power. So one thing I didn't show in my slides was the prevalence of food insecurity from 2019 to 2020 was unchanged, which I don't think I would have believed it if you told me that in May 2020 when we were seeing those long lines at food banks. But it in part because we strengthened our federal food programs, we had the stimulus packages, we provided so much economic and food support in a very short period of time that it allowed the prevalence of food insecurity between those 2 years to be level. And I think that is an incredible accomplishment. And it just shows that if we have the political will, we can get that number even lower and closer to zero.
Thank you for that. Karen, this question is for you. It says, I was thrilled to see Ms. Washington's presentation that Black Lives Matters contributes to the prevention of food insecurity in persons of color. I went online and Googled and I found contributors, but no contributions from Black Lives Matters to prevent food insecurity online. Does the panel know of any ways in which Black Lives Matter has focused on prevention of food insecurity?
I think the work that they do in just saying Black Lives Matter, cuts across all sorts of social issues, social economic issues. And I don't think it's just trying to just target and name it by just one individual thing that they're working on. I think the fact that they have brought it to the surface that Black Lives Matter, especially when the impact when it comes to food insecurity is definitely within Black and brown people, that's a statement within itself.
Beautiful. I have a question here that I'll answer. It looks like the question is, how is screening done? Actually, let me do this other one. How do you really find anti-hunger task forces in states? Example, like in California. I'll see, does anybody have anything they want to add to that first? Anti-hunger task force, or how would the team or audience find the right groups to work with, community collaborators to work with? Any ideas on that?
There's a lot of states and counties that have local food policy councils, and so that would be a good place to start. California has the California Food Policy Advocates, and they do a lot of statewide advocacy efforts around food programs and food insecurity. We have one in Michigan. We have one at the county level. So I think see if there is one where you live, because they would be a great starting point. A lot of food banks are also doing advocacy work and advocating for food and economic and housing policies in the counties or in the areas that they serve. So that would be another good starting place. And if you're not sure how to find your local food bank, you can go to Feeding America. They're the largest network of food banks across the country, and they have a great directory of all of their affiliated food banks.
Any other community partners that you all would highlight that you work with? Karen, I want to come back to you really quickly. So another question came in. For an urban farm, how do you change the soil from a gravel lot to a farm? Raised beds only or other options?
So my community garden is over 30 years old, but if you find an empty lot, you need to really remediate that soil, take that soil out. And so what is happening is that you go in, take at least 6 feet of soil out, put down a barrier and bring in new soil and compost. Because soil, especially in older buildings that have been knocked down, have high concentrations of lead. And so you should not be growing food in empty lots that are not remediated. And so good thing to think about is to take that soil out, have it tested, bring in new soil in, and as well as compost. And that's what's being done in New York City, but should be done in other cities as well.
And a follow-up question, how do you keep people participating so you aren't doing everything on your own?
I'm not doing it. I'm 68 years of age. I'm living a great life. I mean, that's why they call it community gardens. It takes a community, it takes a village, not one person. Should never be one person.
What's your approach that you would use? So you highlighted something in particular that many people may want to use, which is, hey, I have a volunteer that may want to jump in and do this. Should that volunteer be compensated in any way? How do we think about sort of equipping someone to actually take that role on?
Well, the decision-making process has to be within the community, in the community gardens. And And people know volunteerism versus people that are being used,
Mm.
and so and a lot of our youth now, a lot of our youth say they want to get paid. They want to get paid, and so having that conversation within your group and community garden, whether you're going to pay someone to volunteer or it's a volunteer run organization, that's a decision that the community makes.
Can I add on to that?
Please, yes.
So I just have an example that's in New York that I think is something that can be advocated for in other cities. So in New York, we have a lot of programs actually that help to pay young people to work. And one is called the Summer Youth Employment Program, where you as a work site, as long as you do something related to health or nutrition, it can be very loosely related. You can apply to be a site, take on interns. They are paid by the city and they work for you. So if you don't have the funds to pay, an intern to work 21 hours a week for you, you can apply and have the city pay them. They're gaining great work experience and working for you. It's a wonderful program. We have youth that apply again and again year after year because they love having something to do in the summer when they're out of school. And I think this is something that can be replicated in other cities. So this is something that, in your city, if you aren't sure if something like this exists, look into it. And if it doesn't, something that should be advocated for.
I'm going to answer one more question and then we'll finalize it with the final question for everyone. So one question was asked was, how is screening done in hospitals, say acute hospitals, and broadly speaking how do you sort of carry this kind of screening out? The screening process is something that, again, we talked about the preparing, the screening, intervening. Typically, you want to incorporate that through some sort of kiosk or written form. In primary care, it's pretty easy to do it that way, to incorporate it into those forms that you give families. I think with other subspecialties, people are finding very unique ways of doing it. If there are other documents, other things that people are filling out, one of the strategies that people do is sort of incorporate those questions into other generic screeners, nutrition screeners and other sort of screeners that you have going on in clinic. You can separate them, you can put them in there and kind of review them as well, and just make sure it's sort of a platform that you ask, that you're able to use to ask families. But always make sure you prime before you ask, right? Prime them to let them know this is something you do universally, and there are resources to support families either way. The last question I'll ask our panel, just to sort of wrap it up. What final piece of advice would you give for our culinary medicine clinicians and audience that want to ensure that they are not worsening inequities or advancing cookie cutter approaches to health when engaging the diversity of families experiencing food insecurity and nutrition related chronic diseases? Emily, you want to start us off?
Yes, I'm going to loosely answer your question because there's something that I just wanted to touch on is dignity in food. And oftentimes we kind of have this idea that, oh, someone lacks access to food, they are food insecure, therefore they should be grateful for anything that we give them. Any food we give them, they should be happy that I provided this for them. And that's not the case. People should have dignity in food. They should have choice in what they eat. They should enjoy it. They should, get that in a socially acceptable way. And we need to remember that. I think sometimes we're like, food pantry, I'm going to put my leftover scraps in a community fridge and I've done my part in helping food insecurity. And we need to remember that we're all people and food is a right, but we should enjoy our food and there should be dignity in it.
I'm going to follow up with that because as a person of color living in a low-income neighborhood, there's this sort of perception of people who are poor, of scarcity, of problems, of being needy. And so I want people to, when you enter communities, especially marginalized communities, ask us what we want, not what we need. Asking us what we need comes from a position of deficit. Ask us what we want comes from a position of power.
I agree with 100% with everything that you both just said. And in my research, there every person that I talked to in those studies that I showed you, they had their own stories to tell about food insecurity that was completely different from the previous family. And so we visited families in very wealthy areas. We visited families in lower income areas. We visited families who had newly experienced a divorce, who were escaping domestic violence. We were visiting families of someone who just lost a job. We were visiting families who had experienced food insecurity earlier in life, and now they feel like this is part of the life cycle. They experience it again. So everyone has a different story. There is no one size fits all solution. And talking to the patient to try to figure out how you can best support them and serve them is really key, because not everyone benefits from a SNAP card. Not everyone can benefit from WIC, but trying to understand where they're coming from and how you can meet them there to help best serve them and promote their health. That's the only thing I can suggest.
So we actually were given a few more minutes because the conversation has been so rich. They want us to go a little bit longer on this. So we'll spend a little bit more time just answering these last few questions. And if there's any other audience questions, please feel free. We can take them directly from the audience to our panel. But one question that was here is, will we ever change the Farm Bill to subsidize the healthy foods people need? Will we ever change the Farm Bill?
Hopefully, yes.
Vote, make your voices heard, write to your policymakers, tell them what your priorities are.
Beautiful. Any other questions from the audience? I got one here.
Different types of ways of farming and aquaponics and hydroponics. So we have this new mayor who, for the first time, is looking at opening up an office of urban agriculture in New York City for the first time. And what we're pushing is that right now we need every sort of organization, a way of and growing with a water medium. And so the emphasis, folks, is not trying to pigeonhole and say like one size fits all, one method of growing food is the best. Is how can we use different techniques of growing food, making sure that the food that is being grown is given to the people that need it the most? Good question.
We'll take one more question. Is that two different questions? Two different questions. You're not doing a shared question like here. Okay, let's do two more questions. Yeah? Yes. Yes. And then we'll close it up.
Hello, thank you so much. This is an amazing conference so far. And I have to say how diverse this panel is fantastic. I go to lots of culinary nutrition conferences, and this is the most diverse city that I've seen. So thanks for that. The question is, how do you work with community chefs or culinary nutrition educators, activists to support the work that you're doing? And do you work with them? How? And what role do you see as playing? I'm a community chef myself from New York. Thank you.
I'm not going to answer that question because I already work with her. So, but I think your question, is relevant, is the fact that Here you have a wealth of people in your community that know how to cook, and they want the opportunity to to use community chefs. And so a lot of the community chefs that we work with, as you know, work with our farmers market, our community-based farmers market, because it's one thing to give out food, but it's another thing to teach people how to prepare it. And so we have cooking demonstrations at the market where the community chef person educates the community on the types of food that's out there at the farmers market and supplies them with recipes, cooks the food, have them taste the food, and then the participants go home with the recipe and the food to cook on their own.
I want to add to that too. For all of you who are opening teaching kitchens or getting funding for teaching kitchens, which a lot of people have already told me about recently, which is very exciting. Keep in mind your staffing and who you're hiring. We love our culinary medicine family, but we want to make sure that we are hiring chefs from the communities that we're working in. The teaching kitchen I opened in the Bronx, I hired someone who had never heard of the Goldring Center or culinary medicine or any of this, but she grew up in that community. And I wanted her to be teaching the cooking classes because she knew what the people wanted to learn. And she did a great job and developed so many recipes that I would have never thought of. And people loved them. They loved learning from her. So we need to be hiring from our communities. I know we love to stay within the family, but we got to grow the family and make it bigger.
Excellent, excellent. Last question over here. Make it good. No pressure. No pressure.
My question is kind of twofold. I guess the first half would be, how are you all acquiring funding to maintain this great work you do? And the second half is, how are researchers working in collaborations with the grassroots, probably through some sort of governmental funding and or state privatized funding?
Great question. It's good. So it's good.
I don't know if maybe we want to go down the line. So I work for a community neighborhood organization. We are associated with a NYCHA housing development. A lot of which is New York City Housing Authority, is that right? And so we honestly rely a lot on private donors. So we pay people to reach out to people to get us money. So if you can do that, do it. But a lot of it is grant funding as well. There is, I think, a growing recognition of what we are doing here within, governmental organizations. And so there's a lot more money now from the USDA, from other grants to just do work in addressing food insecurity. And if you can show that there's a need, and if you can show that what you're doing is making an impact and not just slapping a Band-Aid on something, there is funding out there and grants that you can apply for.
I always tell my folks, my peeps, go to your elected officials. That's what you vote them in for. Don't be afraid to go to your elected officials and ask for funding. And then also, your story is so powerful. Storytelling is so powerful. A lot of the funding, I'm on a lot of organizations, but a lot of it is based on storytelling, putting your story out there so that people understand your work that you're doing and they want to fund it. Some of it is private funding, some of it is public funding, and some of it, believe it or not, is individual people like you that want to make a difference in the work that we all up here are trying to do.
I would say on the research side, for myself and my colleagues, we will ask for funding from NIH and USDA. For some of the center or foundation grants, there's a growing movement towards working on food insecurity and food systems research. And there's sometimes there's calls for academic and community partnership grants, which I find really interesting because they want people with different perspectives working together and having a clear contribution to the project. So it's not just like the researchers doing everything and the community partner is just there in the background, but really like a true partnership. And so we recently applied and were awarded one of those grants. So I work with food gatherers, our local food bank in Washtenaw County in Ann Arbor, Michigan. And we're doing something within the Michigan Medicine University hospital system around screening for food insecurity in our primary care patients. But I think for like healthcare providers, if you're interested in this work, then connecting food insecurity to a clear health outcome is always helpful if you're looking at NIH or sometimes even USDA funding, because they want to see that health pay off at some point, whether it's cardiovascular disease, diabetes, if it's like children's development, children's physical or mental health, all of those, when the connections are very easy to make because the literature is all there. But tying food insecurity back to a health outcome is always something that a government institution like NIH will want to see.
Say one more thing and we'll end up. So I think it's interesting to understand that food insecurity by itself oftentimes doesn't trigger that incentive or that investment into the work, like Cindy is mentioning. Some of the work that we do in the pediatric realm, food insecurity by itself hasn't really grabbed the attention as much as when we are associating it with that concept of nutrition security, give or take the term. And I think it's important to recognize that NIH and federal dollars are important, but if you look for these calls for grants, sometimes you're able to tap into some like-minded local national organizations. For example, one of the funders for some of our work has been No Kid Hungry, and National Anti-Hunger Group, and Vitamix Foundation, actually. And what they've been helping us be able to do is really be able to invest in working with our community in doing produce prescription programs in particular that couple along with community cooking classes and those kind of things. We work with our local food hubs, identify farmers of color, get that food delivered to our families, and work with our families as well. That's been a really phenomenal thing and really being able to help us bring these worlds together as well. So think about foundational grants and supports as well that can help you get your feet under you, right? So you can actually work with those MCOs in the future. That's another group as well, thinking about working with your MCOs, your managed care organizations. When they recognize the value of what you're doing, are they willing to then invest in that? And I think those are all things to think about. Tim's team will continue to bring up more to the table. But again, let's first start by thanking our panelists today.